Thank you. I'd like to thank Professor Raymond and the organising committee for inviting me here to this symposium today. I'm a nutrition scientist and I work in public health nutrition. And as Professor Raymond said, I'm based in Manchester in the UK. The title of this presentation is Beer and Calories, and it's based on a report, a scientific report I wrote, which was commissioned by the Beer and Pub Association, which is a trade organisation in the United Kingdom. And it was published in 2013. And to give you some background, it's the result of an audit that the Beer and Pub Association carried out on UK national and lifestyle press and media to really out of concern that there's such a misconception, particularly in the United Kingdom, on beer and health, and very little is written in the media about this, and in the general public has a lot of misconceptions. What they found was interesting. Basically, the media don't have barriers to writing about beer. What they lack and what they want is more information, authoritative scientific evidence that basically gives them the facts on beer and health and all forms of alcohol. So with that in mind, and also with the coming out of this review, the understanding that there is a real misconception amongst the public that beer is very high in calories and is resulting in abdominal obesity and general obesity. I was commissioned to write this report called Beer and Calories. Oh. Okay, so this is the report I'm talking about. So this was written in 2013, published in 2013. It's a scientific review looking at the evidence. The question being, does beer result in unwanted weight gain more so than other forms of alcohol? And is beer much higher in calories than other forms of alcohol? And the idea was to present a list of facts and information which then could be used for the media if they so chose to write about it. Interestingly, there was a lot of interest in it, and a lot of media was written about on it, nationally and also internationally, and on radio, online, and also social media. As Professor Raymond said and started the meeting today, there is no dispute that there is an ill effect with excess consumption of alcohol. It causes mortality and increases morbidity. But what's interesting is this growing awareness in the scientific community that in small to moderate amounts, alcohol can have some beneficial effects on health. Interestingly, when you look at the media and when you listen to what the general public are reading about and talking about, while alcohol and health is seen as a misnomer, there is this strange perception that wine is one of the only alcohols that may have a health halo. And this goes back to the days of the French paradox research, which was done in the 1990s and which was referred to earlier on in the symposium, whereby French populations drink a lot of red wine, eat very high-fat diets, which yet have lower incidences of coronary heart disease. So wine does have this health halo, but beer, unfortunately, is seen to be only detrimental to health when it comes to the general public's perception, and it seems to be the culprit for what we call, anecdotally, the beer belly, which is this abdominal obesity around the midriff, which is very unattractive. In the UK in particular, beer does have quite a negative perception sometimes in the press. This is, I don't know if it's fair to show this cardiologist. He was in the papers in the Daily Mail, which is quite a big newspaper in the UK, and he was extolling the virtues of a glass of red wine for all his cardiac patients on the hospital wards. So this is the sort of headlines we would get in the UK. You know, beer is very good, wine is good for you, but beer is not. So in terms of beer and calories, one of the biggest biggest faults that beer carries is this idea that beer results in this beer belly. And again, if you see the images used in the media when they talk about beer, you see this beer gut, which is fairly unattractive. What we mean by the beer gut from a scientific point of view is we talk about abdominal obesity or abdominal adiposity, and it's basically increased weight circumference, so it's a large girth around your waist. Now this does carry risks in itself. Where your body fat is distributed does have an effect on your risk of certain diseases. So if you are what we call an apple shape, which means that you're quite rotund around your middle, you tend to have a higher risk of metabolic syndromes and also cardiac disease. whereas people who tend to carry extra weight around their hips are typically called pears. You tend to have a lower risk. So where you carry your body fat is associated with risk of certain diseases, and men tend to carry excess weight around their midriff, hence the beer belly misnomer. So to put the whole debate into perspective, do we care whether beer is associated with weight? Is it fact or fallacy? In Europe, like the rest of the world, we have a major obesity epidemic, and according to the WHO figures for Europe, 50% of us are overweight, and up to a fifth of us are actually obese, clinically obese. And this is a trend that's on the increase, and more frighteningly, it's a trend we're seeing in young children. So this is a huge, huge problem. It affects mortality, it affects morbidity, and of course it's a major cost to the health services. So when beer comes into the equation, that beer is high in empty calories, it's higher in calories than other alcoholic beverages, that beer drinkers are obese, and that if you drink beer, you'll get a beer belly. It's an important sort of area to really look at. Does beer actually cause obesity, and is it associated with what we call empty calories? Now, in nutrition, we have a very simple energy equation when we talk about weight control, and here it is. Basically, we want energy balance. So the energy that's going in the form of calories should balance the energy that's going out, and that's in exercise, or what we call basal metabolic expenditure. So that's your breathing, your enzyme reactions, whatever in the body. So calories in food and beverages should equal calories out, and then you get stable weight. So simplistically, these are the three charts. The first chart at the top shows you isocaloric balance. So this is weight control. So your calories in, balance your calories out. If you're trying to lose weight, you take less calories in and expend more calories out, and you lose weight. And then if you are in what we call positive caloric balance, your calories going in are exceeding your calories going out. So very simplistically, that's what energy equation looks like. So beer belly, is it a myth or a fact? Does beer, compared to other alcoholic beverages, increase the risk of overall weight or being obese, or is it associated with this abdominal obesity, or beer belly, as we anecdotally refer to it as? In the interest of time, these are just top-line results, and I'm just going to tell you that in terms of the first question, the effect of beer on BMI, which is body mass index, which is basically a measure of body fat. There's lots of observational experiments and experimental studies, and some of them have been presented today. Overall, if you look at the body of evidence, high consumers of beer or high consumers of any other alcoholic beverages, consumption like that results in a higher BMI. But those who have a moderate consumption of beer or any other alcoholic beverage often have a normal BMI or even a lower BMI. And that's not surprising from a nutrition point of view, because it's down to calories at the end of the day. But what really the evidence is showing us is the amount of calories coming from the alcohol, not the type of alcohol being consumed, that's causing positive energy balance, which can result in obesity. So it doesn't matter what sort of alcohol you're taking. If you're taking excess of calories, it will result in weight gain. And particularly if you don't compensate for those alcoholic calories in other ways, either such as exercise or eating less or other meals. So it's really down to personality and lifestyle factors, as a lady earlier was talking about, and smoking and education as to whether you will put on weight, whether you drink beer or not. But overall, drinking beer is not associated necessarily with weight gain if it's in moderation. If we look at abdominal obesity, and this is when we use the measure of waist-hip circumference, so it's a measure of your waist to your hip, and that will give you an indication of whether you're an apple shape or a pear shape in simplistic terms. Again, lots of prospective studies have been carried out. They tend to be about 8 years long, and we can see from those, again, on an epidemiological level, that excess beer consumption will lead to an increase in waist-hip circumference, which is what we call the beer belly, but similarly, excess wine consumption will also lead to increased weight around the midriff. In terms of all the evidence, it's showing that moderate beer consumption is not necessarily going to lead to abdominal obesity. It really depends on how many calories you're taking in the beer, and it's similar for any kind of alcohol. So alcohol amount is important rather than type. And if you look at the evidence, less than 30 grams of alcohol is not associated with an increase in waist hip circumference. But if you're increasing your consumption to over 48 grams per day, then you are seeing increased waist hip circumference. So it's really all about the amount of alcohol you're consuming. If it tips you into positive energy balance, you're going to gain weight. And then if you gain weight around your beer belly size, area here, it's to do with the variation fat patterning that just happens on a population scale. So simplistically, again, beer and weight, the first point is if beer is causing excess calories to go in, you can have extra weight gain. But similarly for any other beverage or food. And it's all down to the energy balance equation. If you look at beer, is there something intrinsically in beer that's causing this weight to go around the stomach area? No, there isn't. The evidence doesn't show it. Not on an observational level, it doesn't show it. At the end of the day, as we say in nutrition, all calories are equal, and it's energy balance, and it's the old boring mantra, moderation in everything. So excess calories can cause weight gain, and it doesn't matter whether it's in a glass of Coke, it wouldn't be Diet Coke, it would be the full sugar Coke, whether it's in beer or whether it's in wine. Any excess calories, if you don't maintain your energy balance equation, you will gain weight. So moderate alcohol, be it beer or wine, doesn't cause weight gain if energy gain, doesn't cause weight gain if energy balance is maintained. Waist-hip ratio will increase with weight gain and is only a consequence of excess calories, not calorie type. So the development of beer bellies within a population is really the result of natural variations in fat patterning rather than any link to beer. So it's not beer that's causing it, it's just that you're putting on weight, and you tend to put on weight around the midriff, and it's excess calories. In the UK in particular, there is a real misunderstanding amongst the general public about how much calories are in beer. And for example, we know that 10% of people actually think beer contains fat. 74% of women overestimate the calorie consumption of a glass of beer, and about 60% of men do the same. We also know that as a nation, we are obsessed with dieting, like many other countries. And there's a great headline here: Brits spend 14 years of their lives on diets, survey claims. So we are obsessed. We're a very overweight country, and we're all always dieting. And we're dieting with very poor nutrition awareness as to what we should be doing. So beer and calories is the view that beer is very high in calories compared to other alcoholic beverages. Is this true? Well, calories come from 4 sources. They come from what we call the macronutrients. So simplistically, we get our calories from protein, carbohydrate, fats, and alcohol. And you can see here in the blue box, a gram of protein equates to 4 calories. Similarly, for a gram of carbohydrate. The big calorie donators are fat. So 1 gram of fat results in 9 calories of energy, and alcohol is 7 calories per gram. So if you're looking at alcoholic drinks, you can basically say anything that's very high in alcohol will be higher in calories than something that's lower in alcohol. So when we compare beer to wine and other beverages, beer will come out as less calorific because it tends to have lower amounts of alcohol in it. So a half pint of bitter with an alcoholic value of about 3.8% equates to 90 calories. If you were to compare that to a glass of red wine with quite a high alcohol content of 13%, that's about 139 calories. So you can see beer is much lower in calories on a portion size than wine. And interestingly, if you can see this cup of cappuccino coffee, there's more calories in a cappuccino than there is in a half a pint of beer. So beer isn't particularly high in calories, but it really depends on the amount of alcohol in it. But as in terms of the idea that beer is higher in calories than other alcoholic beverages, it's certainly not higher in calories than wine. When it comes to the idea that beer is empty calories, well, beer is a source of nutrients, and that's been shown by the presentations we've seen earlier. We've heard about polyphenols, we've heard about soluble fiber. In terms of micronutrients, various B vitamins and some of the trace elements, because beer is brewed from grains and yeast, it's a very good source of these micronutrients. And this table shows the percentage that beer contributes to various micronutrients in the British diet. And you can see here there's various vitamins like the B vitamins, niacin, riboflavin, B6 and folate. And you can see up to about 10% of the British public are getting their B vitamins from beer. Beer is also a pretty good source of phosphorus, magnesium, potassium and iodine. And some of these nutrients are deficient in the British diet. Now, I'm not proposing that we campaign to increase our vitamins and our mineral intakes via beer, but it's interesting to see that beer, as part of a healthy diet, can be a source of these micronutrients, and these are nutrients that can be lacking in the diet. There is some evidence to suggest, depending on the type of beer you drink, that 2 glasses of beer can equate to 10% of your fibre daily needs. And we do know that 80% of people across Europe are deficient in fibre. So again, it's a benefit of fibre. The other area of interest, in addition to the antioxidants and the polyphenols, is of course silicon. And there's lots of really new evidence coming out to suggest that silicon in beer makes beer very, very singularly different compared to other alcoholic beverages in terms of bone health. So in addition to not being particularly high in calories, not necessarily giving you a beer belly, beer, in moderation, again, as we heard from the last speaker, does have health benefits. You know, there is some big epidemiological studies that are calculating risk factors, and we have great headlines like blood pressure beer can be associated with a 14% risk reduction in hypertension, or you can reduce your risk of diabetes by 25% if you're a regular low consumer of beer. Again, bone health and silicon is receiving a lot of interest. And even heart disease, 31% reduction in heart disease has been calculated to be associated with drinking a daily pint of beer. So these are just some of the sort of studies that are going on at the moment. These are epidemiological, they're observational studies, and they're sort of trend work. But at the end of the day, we do need to communicate to the general public how to moderate alcohol consumption and how to have low to moderate levels of alcohol. And one of the benefits of beer in terms of this message is it's low in calories, so that's important from an obesity point of view. But it does have benefits over other beverages like, for example, wine, in that the glass size can vary. Traditionally in the UK, we drink beer by the pint, but here in Brussels, it's a bit more sophisticated, and we were drinking beer by 125ml glasses last night, and that's something really that the British public needs to adopt. We need to drink it in smaller glass sizes. So there's an opportunity for us to communicate to the public, drink beer in different size glasses. There's a picture of the various glass sizes you can have. We also need to, from a UK point of view, kind of communicate to the public that beer can accompany food, because again, that's a way of controlling or moderating your beer intake. From a calorie point of view, the message is simple. The higher the alcohol content of the drink you're drinking, the more calories you have. And beer, again, is an example of a drink that can have a range of alcoholic contents. And again, that can help moderate alcohol intake. Unlike other forms of alcohol, it is served usually in single serving units. So you don't have to share however you buy it. So again, that's a good way of moderating intake. And at the end of the day, I guess, you know, everything is in moderation in diet when it comes to health, and beer is a refreshing drink, and it can be part of a healthy diet, but again, only in moderation. So in summary, beer isn't just empty calories. Moderate consumption does not cause weight gain or beer belly. Beer is lower in calories than other alcoholic beverages, and really, when we're talking about weight control, it's all about positive energy balance being avoided. That means gaining weight and compensating for the calories you're consuming in your alcoholic beverages by eating less at other meals or exercising more. So the message is moderation. And this is quite an interesting case study that the British Beer and Pub Association basically commissioned this research. They basically packaged it up for the media, and as a result, the media were quite interested. And even earlier this year, there was quite a big piece in one of our papers, which is quite an influential paper, that Mail, that a very heavy, about 2-page spread on the benefits of beer. And this is quite unusual to see so much interest, but it's an example of if we can understand what the concerns or the misconceptions are amongst the public, we can address them by providing the media with good, scientific, credible, authoritative, and although may I say cynically coming from the Beer and Pub Association, nonetheless, if it's authoritative, that, you know, we can get the message out to the general public. Thank you.